So welcome back to another edition of the Heart to Heart podcast. And my guest today is Kevin Bardosh, who's a social and political scientist. So Kevin was the lead author on a paper that showed there are consequences to having lockdowns. And that's the main reason why I wanted to have him on the show today. So Kevin, welcome to the show.
Great to be with you.
Excellent. Well, I'm happy to chat with you here today. And just before we get started, before I ask you, a bunch of questions about that paper, maybe a few questions outside of that paper, can you just give the audience a little bit of a background on yourself?
Yeah, sure. So I'm a university professor at a couple of different universities. So I'm an affiliate assistant professor at the School of Public Health at the University of Washington. And then also at the Edinburgh Medical School in the UK. And I do a lot of consulting work for global health organizations. Most of my work falls under what we call medical anthropology. So understanding how human beings and society responds to infectious disease outbreaks, but also endemic diseases. I've worked a lot in Africa and Asia on what are called neglected tropical diseases. So parasites, bacterial infections. A lot of that has environmental exposure. So you get them from animals, let's say. And I've also, previous to COVID, I was working in the epidemic prevention space. I had led a program for Zika in Haiti, and I was also involved in the response to Ebola in West Africa. So this is the area of pandemic response is something I'm very familiar with. I've led a bunch of large studies looking at how social science can help better respond to disease, pandemics, and epidemics, and that's kind of a specialty area of mine. So it's been a really wild ride the last 2 years to see that world sort of turned upside down and also brought closer to home, because most of my work, like I said, it was in the global South, but I'm Canadian, I'm American as well, and I've been experiencing the pandemic as a North American and also as a European, which has been very, unusual, I think, in some ways, and not always as we expected it, I think.
Yeah, no, that's interesting. I didn't know all that background about you. So it seems like obviously you have, a lot of experience, working in, different types of pandemics, being, meaning that COVID's not your first one. And then, yeah, you're right. I mean, unlike a lot of like a lot of people, like I've mostly just been in Canada during this entire pandemic, so the experience that you get in Canada, even in different parts of Canada, is going to be different in other parts of Canada and other parts of the world. So I think it's good to have more of a, like, when you're in different countries, experience that you're going to have a different perspective. You're going to have more perspectives.
Yeah.
And so, that's very, very interesting.
No, exactly. And just as a kind of a quick overview, I spent 10 months of 2020, 2021 in France and Germany, moving around with my kids. That was really interesting, trying to negotiate going around Europe during a pandemic when there were impending restrictions and lockdowns. And you get into all sorts of weird situations, like trying to shop for kids' pants. But the pants section is closed off and it's all restricted, but the groceries in the same large shop is open. Or hearing accounts of, let's say, in the French Alps, helicopters chasing hikers because they're disobeying the lockdown rules. In France, many North Americans don't know this at all, but in France during the lockdowns, and there were a couple of them, you actually had to carry papers with you and you had to fill them out by hand saying, I left my house at this time, I'm going here for this reason, and I'm going to return at that time, and sign it. And, you could get stopped by the police and they would say, where are your papers? And if you didn't have your paper, you would get fined. And there were all sorts of sort of strange, we all have these stories of strange, obscene consequences to breaking rules and whatnot. But I remember hearing of somebody who was, they took their daily walk that they were allowed, during the lockdowns, but they were wearing flip-flops. And so the police fined them saying, well, flip-flops are not an adequate exercise shoe, so hence you're not going outside for your daily round of exercise. And I think we've all experienced
What country was that in?
That was in France.
France seems insane. I didn't know anything about this. And I want to ask you too about the papers. Like, how exactly does that work? Like, they give you what do they give you? Like a bunch of papers where like you sign them and then you go out each day? Like, how do they keep track of this paper system? Like, how does that like work?
Yeah, I mean, that's a good question. How do they keep? I don't think anyone was keeping track of it. It was just sort of this directive, from the government, as a way to try to maintain, I guess, rule-abiding citizens, right? And I mean, I'm half French, so I can speak to sort of French culture, even though, and I was born and raised in Montreal as well. And there is that very bureaucratic tendency, right, within French society, and as far as I could tell, there was no like way that was kept track of, but it was, a threat. Like if you didn't have your paper, which is, and this is a lot of the way that, governments have tried to enhance compliance during the pandemic has been using these tools, behavioral nudges, we could call them, right? Like, okay, if you go out for your 1 hour, you need to fill out this piece of paper, right? And it's a mechanism by which you're trying to get this desired outcome of compliance, but it also feels very patronizing, and also ridiculous in many ways, right? And
Very patronizing.
yeah, and it also encourages like this negative perception of the state,
Yeah.
overreach and sort of unjustful rules, extension into private life, etc., that we sort of talk about.
Yeah, I'm still kind of like, just absorbing this information with France, like, because I always saw them as a fairly progressive country, or a country that would treat their citizens well. And the fact that they were had like papers, that seems crazy to me. Like a lot of the news that I've heard, like the worst country I would have said would have been Australia. It seems like what they've
Right.
gone through was seem to be have the worst lockdowns and the strictest measures. But based upon what you're saying, like maybe France has actually been the one that's had the strictest lockdowns, or the ones that seem to be the most patronizing or the most limiting in terms of freedom.
Yeah, I don't know if you could really say that. And every country sort of has areas where you could say that they were more excessive, and then perhaps other areas where they were more lenient. So France obviously kept or not obviously, but they kept their schools open a lot more than North America did on the whole. They didn't require younger kids to mask, for example, in schools. But they did have these successive lockdowns with this paper aspect of it, which and amongst many other different sort of facets of it. I mean, in terms of COVID vaccinations, they were one of the first after Israel to impose the passeport sanitaire, right? The vaccination passport, which surprised a lot of people in some ways, but not. It shouldn't have come as too much of a surprise, considering this bureaucratization within the French state that has a long history. So it's hard. I mean, with the pandemic in general, it's hard to make these cross-country comparisons, because, as you know, also in Canada, every province has its own nuances and its own decision making was decentralized in some ways, in some areas.
So Kevin, with regards to the policies on the lockdown paper that you said that that was published, again, like what would kind of be the biggest single thing that you would think was the most harmful overall?
Yeah, thanks for the question. So just to clarify, the paper is not on lockdowns per se, it's on vaccination policy. So it's called the Unintended Consequences of COVID-19 Vaccination Policy, why mandates, passports, and restrictions may cause more harm than good. So it's looking at vaccination policy itself and this turn towards coercive vaccination or mandatory vaccination. But I also have a companion paper that I'm working on right now, which is on lockdowns and non-pharmaceutical interventions. And it takes generally the same, what we call conceptual approach of unintended consequences, right? So you have social or government policy that implements something, and what's the real world outcome of that? That can be positive, it can be negative, it can be both positive and negative. And we often actually, from a government standpoint, the unintended consequences of policy is not often studied, right? For an obvious reason, because if you implement a policy, as a government, you want it to be successful. And so there tends to be a lack of research on the sort of, social effects and the harmful effects for some groups, because technically you can have a policy that's successful, but it harms a small minority of people, right?
Mhm.
So there's all sorts of different ways you can look at unintended consequences, but it's a very useful like concept to apply to the pandemic in general. So in terms of like lockdowns and non-pharmaceutical interventions, I think there's so much to say. On the one hand, like our response to a pandemic respiratory virus previous to COVID was not to pursue this heavy-handed lockdown approach, right? It was actually to try to, and there's this great paper from 2006 written by these quite well-known public health folks, including Henderson, who was really involved in smallpox eradication, where he says, quote, an overriding principle, right, for pandemic response, and this is to influenza, but I think it's applicable as well to COVID, quote, experience has shown that communities faced with epidemics or other adverse events respond best and with the least anxiety when the normal social functioning of the community is least disrupted, right? So this notion, don't disrupt society or disrupt it minimally, right? Don't
That
just
was
go overboard.
2006, you said,
Yeah,
right?
exactly. And so I think obviously you had like these competing narratives in public health prior to COVID. You had that learned wisdom of like, don't blow it out of proportion, don't create fear mongering, try to provide empowering messages and don't shut down society. And one of the reasons, for example, why public health people didn't advocate for border closures early on in the pandemic was because of that received wisdom. If you shut down borders, poorer countries are going to face the consequences of the lack of transportation and supply and delivery, and you're disrupting the economy, you're breaking down global supply chains, and that has all sorts of ripple effects. And this sort of conventional thinking was that won't really even stop the transmission of a respiratory virus. Of course, if you do it heavy-handedly, like we've seen with Australia or New Zealand, you can stop the transmission for a period of time of a respiratory virus, but with what consequence? So that was sort of pre-COVID thinking, right? And I think we kind of threw that rule book out of the window. And it's fascinating to ask, well, why? I think a lot of that has to simply do with momentum, right? And also the nature of media today. So we all became sort of baptized into the pandemic with these horrific scenes out of Wuhan and then out of Italian hospitals, threatening to over sort of this massive wave of death and destruction that was going to sweep over the world. And that was the sort of narrative that we were all baptized into it. And I think that fear that was generated, that sort of sense of panic, was really hard to address and to reduce and to bring our functioning sort of our reasoning abilities to the table after that initial phase. So my opinion is like a lot of the lockdowns and restrictions by April, certainly the end of April of 2020, were no longer needed. We needed to dial down the fear, not to say that we shouldn't do anything, but the public narratives shouldn't have been so focused on ramping up fear. And I think we see that within the media. Studies looking at media framing in the US, for example, found that in 2020, 91% of media stories about COVID were negative, meaning that they were presenting an anxious, fearful view of the virus, whereas other countries had more positive coverage. And America is also a nation of fear-based media. If you think about the response to 9/11, I was a Canadian who moved down here just before 9/11 took place. And so I remember that sort of full media narrative. And I think there's a lot of analogies between the 9/11 era and what we've seen with COVID, including in dissent, or what I would say is reasoned alternative perspectives to the mainstream narrative. I remember Howard Zinn, who's a very famous American historian who's written People's History of the United States. He actually came to my school, my high school, when I was 17 in 2001 in Boston, and gave a talk. And his whole talk was essentially questioning the drum roll to war in the Middle East is not anti-American, right? And that was the atmosphere at the time. If you even question the idea of like, I remember people saying things like, we're going to make Afghanistan a parking lot, right? That was the things said in the streets of, or the hallways of my high school. So we have this groupthink, right? And I think we also seen a similar thing take place in the pandemic.
I
So I
think
mean,
has been a big thing during the pandemic. I think that especially amongst a lot of physicians, not just physicians though, but they're very afraid to say anything against what their colleagues are saying,
right,
and they just want to. And a lot of people, a lot of doctors too, are being censored. Like they're afraid to say anything because they feel like if they do say anything against the narrative, then there's going to be repercussions for saying that, which again is like basically a restriction of freedom of speech. And it's
right,
also doesn't produce the best ideas. Like when you have groupthink and everyone's saying the same thing, you're basically just presenting one idea to the group, and
right,
then that one idea might be terrible. But if you have multiple individuals who are making multiple different opinions based upon their own experiences,
mm,
their own education, their own feelings about it, then you're going to have a different set
mm,
of opinions you can get to
mm,
choose from. You're going to get to choose the
mm,
best one and see which
mm,
one wins.
mm,
We didn't get to do that. All we
mm,
did was just got to follow one narrative. We told it this is the best narrative.
right,
There's nothing else that you should do. You shouldn't be questioning it. And that I think is the reason why the response overall has been so poor. And that's also probably too why right now like public health is I mean, has lost all of its validity. I mean, nobody has any trust in public health anymore
yeah,
because of this response. And I think part of that too is that people are upset that people have been censored and that other ideas weren't heard. And
mm,
I go back again to that paper that you said in 2006. I mean, it's they said in that paper you said that they said we shouldn't disrupt society. And I mean, if you look at the disruption of society over the last 2.5 years, I mean, the consequences have been detrimental for
mm,
various different groups and for a large portion of the population, like not just the minority. Like most
yeah,
people have been negatively affected by this.
yeah, and in different ways, and they have very complicated perceptions. And I would say we're in a state of collective trauma to some degree.
Mhm.
And a lot of people feel like their worldview has been sort of put in a blender, which is natural, right? After this level of sort of fear and confusion and anxiety. And to get back to your point about expertise, so it's not just that we were not allowed to hear dissenting views, and when I say that, I mean mostly the filtering that the mainstream media has, because they have immense power at shaping the collective consciousness and awareness of democratic societies and non-democratic societies.
And just
um
a note on that, like I remember Naval saying, and I agree with him too, Naval Ravikant, he says like basically the most powerful people in the world are people who code for social media because
right,
that's what people are staring at their phone all day. So
right,
if you can somehow, and I know for a fact, I mean, it is true that Congress has been speaking to Facebook, has been speaking to other social
yeah,
media platforms, and we know that to be true. And so we know that again, if we are agreeing with Naval, and I would say that that he is right, being that when you say most powerful people in the world, the people who are maybe the most influential on others, on the
mm,
masses of the population. And then you have the government then telling these social media platforms what they can and cannot post. I
mm,
mean, that is restriction of a freedom, of a freedom of speech, and it's also not allowing again the best ideas to get out.
yeah. Yeah, and I agree. So to get back to my point, the governments were also having a restricted view of the crisis, and this pans out actually in a number of studies that have come out looking at the composition of scientific advisory groups in 2020, right, when the pandemic was first emerging as a huge problem. And there's studies in the UK, in France, in Germany, in the US, looking at the composition of these groups. And most of them their biomedical expertise and infectious disease experts, right? So virologists, epidemiologists, physicians. Very few of them had social scientists or economists, and so or ethicists, right? So you had this narrowing of expertise at the very beginning that I think really shaped the way that, or the reason that we didn't approach lockdown considering more the costs and the benefits of this policy. So I think that there was a problem with who was sitting at the table while these policies were being implemented or designed and implemented. And getting back to my comment about nudge theory, right? The idea that governments can manufacture what's called the architecture of decision making and behavior for society without them knowing it, right? So these are the kind of stickers on the ground, right, as you go into a shop, or the way that campaigns have been designed, right, to encourage compliant behavior. I think there's a large conversation that we need to have in democratic societies about the ethics of doing that, and whether we agree with using, psychological insights to manufacture compliance with government policy, because we saw that took place in a large way during the pandemic. We saw the sort of post 9/11 surveillance state in some cases be redirected onto domestic populations in a new way. So basically the way that I'm thinking about lockdowns, I think there's 6 problems. This is what I'm proposing in this new paper that I'm writing. There's 6 problems right now that we have with COVID-19 lockdowns. One is an approach problem, which is what I just articulated to you, that there's this very strong theoretical idea in public health that you shouldn't impose huge hammers. You shouldn't do policing, right? You shouldn't punish people as the basis of policy, or else you're going to have this distrust problem. You're going to have a reactance effect. People are going to try to get their freedom back. They're not going to see public health as some sort of empowering, benign, or helpful, arm of the government. They're going to see it as a repressive, punishing, dark, and ultimately authoritarian arm of the government. And public health has always had to balance these two these two faces of itself, because there's always been fines or restrictions or consequences associated with public health policies. You think about food hygiene policies for restaurants, right? There is always this sort of regulatory aspect to it, but it's a very fine sort of balance that you always need to take with that. And I think we also see that issue with the mandating of COVID-19 vaccines, right? So we have mandates for vaccines in many of our societies, for school vaccines, right? And most of us accept mandates in that context. There are often easy ways for parents to get exemptions from that by filling out a form or something. It's not like kids are not allowed to go to school in Canada, or in most states, at least, or provinces in North America. And I think that's a good thing. You can have a mandate. And then for those people who really, for lots of different reasons, and this is part of the problem with mandates, is humans are so irredeemably complicated, right? We're so complicated. How can when governments create policies, they have to allow some mechanism for that complexity, that diversity of thought and background and experience to be justly expressed, right? So, for example, people that I know who are not vaccinated against COVID include individuals who are recovering drug addicts, who are screwed over by the pharmaceutical industry, individuals who have histories of rape, domestic violence, et cetera, et cetera. So a mandated vaccination policy for workplace doesn't take into consideration those life experiences. So anyhow, getting back to the notion of public health, we have these mandates for school vaccinations, but we've never had this level of heavy-handed ness, right, around a vaccine, especially for adults. And I think that's very unique. So we have this kind of approach problem with COVID, this movement towards hammers and policing. Number 2 is, I think we have an evidence problem. I don't like, if you look at the US, for example, and you compare states that pursued very heavy lockdowns, restrictions, mandates, vaccine passports, and those that didn't, on an aggregate level, like you're not seeing a big difference, right? And there's quite a lot of papers now that are showing that many of these really massively inconvenient policies, right, that we had, like you can't see your loved one at a nursing home if you know, for a year, or if somebody dies, you can only have two people or whatever at the funeral, right? I mean, public health had this unprecedented infringement into domestic life, into social life. And a lot of these policies, I don't think were very effective. And I think the evidence is starting to show that. Like another area would be outdoor transmission, right? So in 2020, we could have been advocating for people to take time outside, right? To meet each other outside if you need to, because humans are social creatures, and there's this huge opportunity cost to just locking everyone in their houses. So I think we have this evidence problem. And we also have an evidence problem with masks as well. You know, cloth masks being the most sort of obvious example. Number three is a harm problem. There's, you know, if you look at like the academic research right now on the harms of non-pharmaceutical interventions, they're pretty severe. And what people don't appreciate is that they're most severe actually for a lot of low and middle income countries, right? So in Canada, where you could furlough workers and the government could give out benefits, right, that would cushion the effect of from job losses and people being kept at home. But in countries where you have subsistence agriculture, you have the informal sector, which is essentially the economy. Telling everyone to stay home is absolutely devastating, because you don't know where your next meal is going to come from, right? You don't have a lot of money. You don't have any money in the bank, or very little money in the bank. And when we evaluate lockdowns, we need to think about them as this global policy phenomenon. You can't just say, oh yeah, well, lockdowns worked in like New Zealand and Australia for, you know, a year and a half. So hence lockdowns are good. They were taken up at a global level throughout the world, right? Like almost every country implemented lockdowns and deviations of them. And I think we're seeing huge amounts of like, yeah, mental health problems right now in kids, a lot of social and psychological damage, and obviously also in terms of learning outcomes. The US or North America pursued very lengthy school closures, and it's clear that the you know, reverting to online education is like pseudo education for a lot of families, a lot of kids.
Yeah, it's a good point you make regarding the evidence, because I think that some people have pointed out the evidence with regards to vaccines and things like that, but there also is quite a bit of evidence from non-pharmaceutical interventions. Things like reducing your weight. We know that obesity is a significant risk factor. It's a little bit debatable, but I don't really know why, because there's a ton of meta-analysis on vitamin D indicating that people who have lower levels of vitamin D seem to do worse with the disease. So we have evidence that these non-pharmaceutical interventions can be effective. And then in addition to that, there's also some pretty decent evidence on some of the harms of the lockdowns. Like we were talking about at the beginning of the show too, a little bit about how people are experiencing a lot of fear with this, but also in addition to that, and I did a podcast with a girl last week, and we were talking about it. Masking in children, that seems to be causing a lot of dysregulation. And there was a paper that was published that indicated that when you ask children what they associate masks with, it was 46% of the time they said sadness, and 19% of the time, something like that, it was with fear. Yeah. So that's awful for children. And then there's another meta-analysis. I forget how many studies were pulled into that meta-analysis that just looked at, not specific to masks, but just how it's impacted children in general in terms of their mental health, and it has been negative. So again, like, we don't have a ton of evidence, but there's enough evidence to show that there are quite a few harms to these lockdowns. And also too, there's enough evidence to show that some non-pharmaceutical interventions could make, a very big difference overall in people's outcomes if they do become infected with COVID. And unfortunately, particularly in Canada anyway, I mean, I haven't seen any public health official or prime minister hasn't said anything about these issues. So,
Mm.
it's a very strange thing that people are sort of, skimming over all the evidence that indicates that, lockdowns have harms, and they're skimming over evidence that indicates that we do have, some non-pharmaceutical interventions that could be very helpful, but
Yeah.
then they're just pushing out, all their evidence. It's really just a lot of like confirmation bias, and no one's really looking at the whole picture.
Yeah, no, and that's a good point. And we're talking about the negative consequences, but a true kind of truly balanced conversation would bring in those positives as well, right? And try to have some sort of cost benefit analysis. And you saying, okay, well, one thing that I've wanted to do is to create like a simple sort of XY diagram with all the different non-pharmaceutical interventions in there, and say, okay, so you have net benefit, let's say, from reducing COVID, and then harms, right? And then you try to map them and which ones have the lowest net benefit from COVID, but they have harms. Okay, so let's get rid of those, at least as mandates, right? And then you can have like bigger conversations about those at the top. But we've had this very kitchen sink orientation to COVID. Let's just throw everything at it. And it's been mind-boggling in many regards. So no, I would agree. And I am concerned. I mean, it feels like most people nowadays will say, oh yeah, I'm a lockdown skeptic. Or they'll say, oh, well, we needed a lockdown for the first little while before we had a vaccine, right? And I think we do really have to have more of a public reckoning with what actually took place, and that lack of nuanced conversation about harm, right? And the way that the media played into it, and also people were dissenters suffered, reputational damage and loss of employment, et cetera, from those perspectives. I'm hoping that there's some sort of commission or independent bodies that can come together and do a thorough, objective analysis of this. And I'm not also just like speaking out about vaccine mandates and lockdowns, et cetera, because I just don't think we should have any COVID mitigation measures. That's not true. I just think that we've gone over and above. We've entered this sort of strange psychological area of excess and myopic obsession.
Yeah, we're just not doing a good like cost benefit analysis. Like we're just kind of assuming that lockdowns are not going to have any harms, or that masking, particularly in children, is not going to have any harms. And the
Right.
reality is that when you're looking at any medical intervention, it doesn't matter whether it's a pharmaceutical, whether it's a supplement, or whether it's some lifestyle intervention, the risk has to be less than the benefit.
Right.
And there's many interventions that have been implemented where I think where we're going to look back and we're going to say that this shouldn't have been implemented. Like maybe there was
Right.
some benefit to it, but the consequences of
Yes.
implementing this intervention were much more severe than the benefit. And I don't think like that has really been done with a lot of interventions with COVID. And a lot of it just comes down to in some ways like a little bit of just like virtue signaling. Because if you just tell people that I think everyone should wear a mask, I think everyone should get a vaccine, I think everyone should stay home, that lockdowns are good and that's protecting us, if you say that, then you're going along with the narrative and you're probably going to get some support. But maybe that support is not warranted. Maybe that's actually not the most empathetic thing to do, and that is considered to be the most empathetic and compassionate thing to do for the most part, according to mainstream media. But the
Yeah.
reality is that if you are an empathetic and compassionate person, you want to make the very best decision possible with evaluating all of the data. And I don't think that we've done that. But I know I've kind of hampered a little bit on your number 3 a little bit, and we're going to get to 4, 5, and 6. But maybe have something to finish up before you want to get
Yeah.
to
No.
4,
I
5,
mean,
and
this
6.
great points. So yeah, to get back to these sort of 6 points, and I'll just go through, kind of mention them pretty tangentially, and then we can kind of talk about them. number three is this inequality problem. So lockdowns, and it's hard to get a sense of, public sentiment about these issues, right? So there's a lot of opinion polls, there's some qualitative studies, interview studies, et cetera, but I haven't seen a really good, what we call state of knowledge synthesis right now, looking at public sentiments around lockdown. And I think there's a lot of work to do in my field, social and political science, in understanding people's responses to the last 2+ years. And I'm hoping that, people, that work kind of does get done. So the fourth one is this relationship of lockdowns to inequality. So, previous to COVID, we were living in this new gilded age, right? Supposedly, right? Where wealth inequality was increasing, and lockdowns only accelerated that trend. I mean, it's clear. And if you look at the sort of billionaire class, their wealth grew, over 70%. So growing over from 3 trillion to 5 trillion, right? So this is American billionaire wealth. And most of that was, driven in the tech industry itself. So right now, and this is the US Federal Reserve stating this, that the wealthiest 1% of Americans have as much wealth as the entire American middle class. So that's a society that we're currently living in. And telling everyone to stay home and order on Amazon, mind-boggling enough, it increased the wealth of Amazon. We also have, a lot of US small businesses had to close. Small businesses are operating in a completely different business environment compared to these larger corporations that were able to adapt from lockdowns. And I think we've seen, hundreds of thousands of US businesses, small businesses, close permanently because of the lockdown. And so there's this, and you can see this narrative again of the relationship of inequality to lockdown in some of the visuals that we've seen over the last couple of years. And I think one of the most striking are these scenes of celebrities at banquets, maskless, and then the masked servers who are behind the scenes serving them. If I was to show one representation of lockdown, as a social phenomenon, it would be that. And I think that's a very poignant and striking symbol of the relationship of locking down society and pursuing these restrictions that sort of sacrifice people's social and economic well-being to control this respiratory virus. The fifth one is what I call a media problem. So I kind of touched on that already. This over exuberant media constantly following cases, hospitalizations, deaths are up 12% today, right? And then when you look behind the scenes, it's deaths went up from 10 to 12 people, in my local county, but it will be reported as urgent news that COVID's surging again, right? And for some people, they're digesting that year after year, or over 2 years now, and that has a profound effect on their psychological state and what they're thinking about, right? We've seen, a downplaying of the age-based and comorbidity-based risk of the virus from the very beginning. This sort of focus on asymptomatic transmission and the potential outdoor transmission, and this constant sort of hypothesizing about possibilities. The virus could be doing this, it could be doing that, you don't know. And that has opportunity costs or anxiety costs associated with it. And one of the largest ones is okay, so are reported COVID deaths. And there's still confusion with that. If I go into the hospital and for something else and I get COVID, I'm reported as a COVID death. We started disassociating those only 6 months ago. People, hospitals started to sort of say, okay, no, actually it's with COVID or from COVID. And that is important, right? So there's this sort of media problem. And then obviously the censorship issue, which let's not get into because that's kind of just massive.
But also though, too, I think, in addition to the COVID deaths, versus, with COVID or for COVID, being hospitalized with COVID or for COVID, there's also too a massive disconnect with the vaccine and vaccine injuries. And again, I'm a physician that, I'll be honest, I haven't reported one vaccine injury just because I'm scared to death to. I'm afraid, my college is going to say something about me reporting a vaccine injury. But that shouldn't be the case, and I mean, there was 3 doctors here in Canada this week that all died sort of like suddenly. And again, like I'm not saying that it's from the vaccine, but I just think that like it should be at least considered. Like it shouldn't just be like
Right.
completely dismissed. And I think that that's happening all the time too. And I think that's kind of, fudging up the numbers in terms of vaccine related injuries and illnesses. And so, I think that that's, basically equally as important as, the for COVID or with COVID problem with regards to hospitalizations and deaths.
Yeah, I mean, that's a massive issue, and that's a no-go zone, right? Like vaccine injuries, vaccines are treated as totems in our society. They're like considered holy and absolutely good in this very strange, visceral way that we don't do with other medications, or other things medically related. And I would say that it's a tragedy that people who have vaccine side effects, like severe adverse effects, and certainly those ones who are like permanently disabled and affected by COVID vaccines or any vaccine, are sort of left to sort of the leprosy island and casted aside. There's 2 or 3 good news stories that I know of that discuss this issue. So with COVID vaccine injuries, right? Most countries have not provided compensation to those individuals. Even now, like I think there was the first Canadian case was done a couple months ago. It was in the news actually, like, oh, first Canadian person gets compensation for vaccine injuries. Because it's really difficult if you're talking about, if you're promoting a product saying, okay, well, everyone should get vaccinated, and then you're providing airtime to people who are injured against vaccines, right? Like you're muddling the narrative, right? And this is the thing, is the media just and public health just says, okay, we're just going to say that this is completely safe, everyone should get it, don't worry about it, right? And that's kind of like the story that's sold out to the public. I think COVID vaccines are a lot more complicated. And, for example, like myocarditis being one particular serious adverse effect, that's taken a long time to understand, and we still don't understand a lot about it. But, if you're a healthy, right now in the US and in Canada also, you have booster mandates for university students. So in the fall, there'll be a few hundred at this moment that I'm aware of, universities and colleges who say, if you don't have a COVID-19 booster, you are disenrolled from your studies. 18-year-old male, right? Let's say 18-year-old male has 2 COVID vaccines and has had 2 COVID infections, right? So do they need a booster? Like medically, it's not going to stop transmission after like a couple of weeks or months. It's not going to have any effect really for the most part. And their 2 COVID infections were like a mild flu, and they were sick for like 2 days or 3 days or whatever. So now you're saying they're going to get disenrolled from their studies. And if you actually look at like the myocarditis data on that, and we actually have a paper right now that's in review where we've tried to do a cost benefit analysis for a university campus, saying if you have required 30,000 students to be boosted with the COVID vaccine, what's your rate of hospitalizations averted for that body, 18 to 24-year-olds versus the potential cases of myocarditis? And I think people are going to be surprised by the results of that, because we're showing, this is using CDC and FDA data, that you'll have more cases of myocarditis than you would hospitalizations averted. And we have this narrative of like mild carditis, et cetera, but it's like, do we know that? And what about subclinical myocarditis that's not even showing up, et cetera? So it gets really complicated. And this is like another reason, this late in the game, we don't need vaccine mandates anymore. It's like, it's clear, like the rationale for that originally was sold as stopping transmission, because that makes sense, right? That is then a like mutual societal benefit to other people if you're actually going to stop transmission. I think it was pretty clear like that wasn't taking place much earlier than many people publicly admitted. And I think that's part of the scandal, personally. So, but anyhow, that's kind of we're sort of sliding all over the place. But I'll end with the sort of last point, the 6th point about the lockdown sort of problems that we have, which is now this massive distrust in public health. And it's not just we had this sort of movement to distrust experts and, distrust of institutions, a notion that we sort of lost our story as a civilization. I'm speaking here about, Western culture, Europe and North America in particular. But I think this anxiety is actually quite universal around the world right now. Like there's a strong apocalyptic kind of imagination about the future. The future is bleak. The future is, full of climate change and AI taking over and, changing geopolitical situations, growing wealth inequality, uncertainty, et cetera. And all of this anxiety is partially, being sort of melanged together with this growth of distrust. And it's obviously super complicated to understand, but public health is now, like the military and the security agencies after 9/11, they become embroiled now in the public imagination as part of this deep state, this idea, right, that technocrats and not democratically elected politicians are who are driving sort of the decision making in our national governments, right? And obviously politicians have a checkered history, right, of like leading, right? Democracy is messy, it's dirty, but we sort of have this implicit idea that somehow technocratic governance is better. And I think the pandemic has shown us that technocratic governance, right, actually, sure, it can do things more efficiently, right? Like China is a very efficient state at locking down, but it doesn't care about your individual rights unless it actually is following that sort of benevolent paradigm. And I think like it's quite worrying as we go down this path of existential risk. And I think one of the concerns I have is that we're going to take this lockdown approach to governance and we're going to put it now into climate change. And so our response to climate change is going to be, also this massive sort of social sort of game. And anyhow, I'm kind of losing my words a little bit here, but yeah, so I think we're in a little bit of dangerous water, but I'm also optimistic in many ways because there is this sort of counter movement. And so I would actually make the argument, which I'm going to do in this paper that I'm writing, that being opposed to lockdown is actually one of the most empowering sort of intellectual movements that you can make right now, because it's asserting human freedom and the right to dignity, the right to your own decision-making power as a mature adult, as part of a society where you are a citizen, rather than somebody who is going to be treated like an automated sort of subject. So I think there's a lot of like imagery and that's been woven into our collective psyche from the pandemic that we're still sort of unraveling with, or sort of still trying to digest and deal with.
Yeah, I think that's a really good point, the last point, because you talk about like the psyche, and then like also too this very strong counter movement. And I think once you get into the psyche of the masses in one movement, then it's much easier to initiate the next movement for governmental control and for restricting freedoms, which appears to be climate change. But if you're able to understand that if you're part of the counter movement, you can maybe take some of your freedoms back, and just show that when you're looking at the counter movement and you look at the counter arguments, they're very, very strong. It's an intelligent community. Like, sure, there's some crazy anti-lockdown people, but when I look at the people that I know and I talk to the people that I know, like yourself, who are sort of part of this, I don't even know if it is an anti-lockdown movement. It's just more of like a movement that's like, let's look at everything and do what's best for society without
exactly
all those sort of like blanket statements.
Yes.
And it's not even like anti-lockdown. Like, maybe there are certain instances, like when there's a brand new virus that comes on, we have no idea what to do. Like, maybe it does require 2 to 4 weeks or something like that.
Yeah.
But when you're looking at the counter movement, and I look at the physicians and the scientists like yourself who are involved with it, they seem to be very, very thoughtful people, and people who are very, very good at thinking critically. And that's what I've seen, and in my own physician group, who sort of have the same views as I do. A lot of these physicians do have other ideas that may be against the mainstream narrative, so to speak. Like, and just for example, I don't mean to talk about myself, I say this humbly, but I was the first physician in London, Ontario, where I'm living, to prescribe cannabis, because I really felt that cannabis was a medical treatment, which was very, very taboo at the time. And in late 2018 or early 2019, I started prescribing ketamine, and I've had unreal results with that. I've had two studies published about it. Another study was published using cannabis as well. And those are the types of physicians that I find are in the groups that I chat with regarding lockdowns. And I think that it's important for people to know that it's not just like the Alex Joneses that are out there that are saying that government control is bad, that we need more freedom and this kind of thing. There's a lot of really, really credible, intelligent scientists like yourself, like Dr. Jay Bhattacharya, who's on here. There's a lot of people who are part of this movement, and I think that it's important for people to know that, like, you do have support, and not only do you not have support, you have support by very, very credible people. So, I really appreciate you, coming on the show today and highlighting those points, and congratulations on the publication of that paper. And I'm looking forward to the next paper that you're putting out as well. So, yeah, I hate to do this, Kevin, but I know it's already been an hour. So if you could tell people where they could find you online on Twitter, where they could find more information, where people should be kind of directing their focus for COVID content, that'd be fantastic.
No, thank you very much, and thanks for the concluding thoughts. You can find me on Twitter at Kevin Bardosh, and then also I'd encourage you to look at an organization. It's a charity out of the UK called Collateral Global. So they're kind of advocating for for more research on the collateral damage from COVID-19 policies. So that's a good, credible source, and I encourage you all to check it out. So thanks for listening.
Okay, excellent. Well, thanks again for coming on, Kevin. And that'll be the end of the show. So thanks everyone for listening, and I'll be back again next week.